The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone, and welcome to the newest, greatest episode of the Dental Brief. Excited to have a dentist on today whenever we have dentists. Come on, we're so grateful for their time and sharing with other dentists, so we really appreciate that. Dr. Katie Lee, say hello to everyone.
Hi, thanks for having me. I'm excited to be here.
Yeah, grateful, like I said, to have you here as well. Katie, why don't we start? First of all, let me get your website out there. It's katieleedds.com. Why don't you start by telling us how you became a dentist? What made you decide to want to be a dentist?
Oh gosh. So when I was 14 years old, I ran into a telephone pole head first on a four-wheeler. Wow. I was going about 35 miles an hour, broke every bone in my face from my eyebrows down, had my jaw wired shut for 8 weeks, and then everything fused shut. So I couldn't open my mouth for another 4 years. It took 9 reconstructive surgeries over 4 years for me to be able to, open my mouth, eat, function, and all of those things. And during that time, because my oral health was such a wreck, I experienced a lot of systemic health issues. And so I realized at a very young age just how important your oral health is to your overall health, emotional health, and mental health. So that's what got me into dentistry.
That's amazing. I've heard a similar story to that. I think it's just an amazing thing when somebody has such a traumatic experience that motivates them to do some pretty amazing things. So how long have you been practicing for?
Since 2010. I'm not the new kid on the block anymore. Don't know when that happened, but So what is that? About 14 years now?
Yeah, that's a decent amount of time. So
yeah.
Tell me, I know that you speak to dentists all over the country, right? You're very out there on media and getting around. What are some problems and challenges that you see that dentists are facing that maybe they weren't 14 years ago?
Oh gosh, the landscape has really changed. I think the biggest thing is dentists are under a tremendous amount of pressure these days with the amount of debt that they're graduating school with. I graduated in 2010, so that was in the middle of the Great Recession. And I had about $350,000 in debt, which I thought was insane at that time. And in the middle of the Great Recession, nobody was hiring. And so they wanted you to have, a 2-year residency or a specialty degree, or 2 years experience or residency program or a specialty degree to hire you. And so that was really difficult to get a job, even though I was top of my class. But nowadays, I think NYU and USC just announced that their graduates are going to be graduating with $850,000 in debt. That makes it really hard to start a business. You're almost driven into corporate dentistry at that point because, who can open a practice when you have almost $1 million in debt from school? One other challenge that I hear all the time, and I've experienced myself, is staffing. Back when I first started and up until COVID, really, we never really had issues with staffing. And now there's very few hygienists to support the practices, and dental assistants are becoming increasingly short. So staffing is another big issue that dentists are facing.
So you practice quite differently than a lot of dentists do. I think you've kind of carved out your own little niche, which is fantastic. Let's jump into that in a few minutes. But how have you dealt with staffing issues? How have you overcome those challenges and made that work for you?
I think you have to get creative. When I first started, you really would hire someone and they would work full time, 5 days a week, sometimes 6 days a week, and they would be available for all the hours. And that's just not the reality anymore. And so what I did is I increased the size of my staff. So I have a lot more people, but very few of them are actually full time. So I have to hire to kind of plug in the holes of the practice and be more accommodating, to families and people with young kids and people who want to go back to school. So I've tried to adapt by being more flexible with what I require of my employees.
Yep. And I think that's probably worked out for you, but there's probably some challenges that go with that too. Yeah.
Oh, it's incredibly hard because everything in the office moves so quickly and things change multiple times a day. Things are changing, and it's really hard to keep a consistent message, mission, and vision and keep consistent communication between all team members when, they're moving in and out of your practice. It also leaves opportunity for error or for dropping things within the patient experience. So if someone has, a patient has a lab case or something we need to follow up on, if someone's running out the door to go pick up their child from daycare and someone else is coming in, sometimes that communication is lost. And unfortunately, the practice or the patients can suffer. So yeah, I mean, it's a solution. Doesn't mean it's easy, but it's something that we're doing to adapt.
Yep. Awesome. So let's talk about your own practice for a little bit. You do practice differently. Tell us some things that you do that aren't necessarily inside the box, if you will. What are some outside of the box things that you're doing to set yourself apart in your market?
Yeah, I mean, I would say I'm not intentionally trying to set myself apart. I just believe in a holistic approach to healthcare. And this comes from my own experience, right? Like, when I broke every bone in my face and had all these dental problems, I had so many different providers treating me to try and put, Humpty Dumpty back together. I always make that joke. And it was very difficult to go see all these siloed providers and no one was really communicating. And so that was kind of my first experience with it. And then when I got into dentistry, knowing what I knew and having experience that the mouth really affects the rest of the body, I tried to talk to my patients about how their oral health was affecting their systemic health. And oftentimes when I would refer patients to their primary care doctors or maybe a specialist to get a workup, they would often, repeat back like, where do I find a doctor like this? Or, I have a doc, but I can't get in for 4 to 6 months. What do I do? Or maybe they did actually get in to see that doctor, but that doctor wasn't up to speed on the mouth body connection. And so they would come back and say, my doctor says that they've never heard of what you're talking about. And so we were back at square one. And so what I do is I really take a holistic approach to healthcare. And so I'm in the middle of building a new clinic right now called the Collective Health Society, where we have functional medicine doctors, nutritionists, chiropractors. Eventually, we'll have endocrine and cardiology working in the same office alongside dentists and hygienists so that we can get to the root cause of disease and not treat symptoms, but rather treat root cause.
Yep. So you've taken what you've done in your own practice and you actually consult with other practices as well, right?
Yep.
So tell me, what are some of the limiting beliefs that some practice have about having this holistic approach to dentistry? What are some of the limiting beliefs that they have, and what do you say to those people to help them overcome those beliefs?
Oh gosh, so many. So, this all stemmed from, I wrote a book called Saved by the Mouth, which is all about oral systemic health, and it's written for patients, but it's heavily researched. So that way dentists can appreciate, kind of the depth of the knowledge that's in the book. And from that, I had a lot of clinicians reach out to me, say, hey, can you help me integrate oral systemic health practices into my office? I really think it'll help my patients. And I said, sure. And what I found is when I start working with these people, they'll say, oh, my patients don't have that type of insurance coverage. Therefore, my patients won't pay for this out of pocket. Or my patients can't afford the type of, periodontal care that you recommend. They'll only get what their insurance covers. Or my staff are overworked. There's no way I can add this to their plate. I mean, the list goes on and on and on. And they're all just stories, like you said, that they're telling themselves. They're not actually true.
Right.
And that's really keeping them from getting into this next phase of practicing, which is really oral systemic health. That's where the industry is going.
Yep. So knowing that you do consulting work, sometimes people aren't quite ready for that. If they want to learn more about the way that you're practicing and the way that you help dentists, where's a good place for them to start?
Best place to go is just to check out my website. So I have a lot of resources on there for people. One thing that I'm really big into is salivary microbiome testing. So that's fancy word for bacteria testing of the mouth. And so I have a lot of resources on there for practices actually that they can download for free that tells them all about the different salivary testing companies that are out there. I'm not affiliated with any of them. They're just the ones that I've used. It also gives tips on how to talk to your patients, how to overcome objections, and how to integrate it into the workflow of your practice. So they can start there. And then if they want to reach out to me, they certainly can just book an appointment with me right on my website, and we can talk further about how I may be able to help them in their office.
That's fantastic. I want to go back to what you first said in the beginning. You talked about stress and you talked about debt. And obviously they go hand in hand. Avoiding debt is a great way to avoid stress. But let's just say that you have a pile of debt right now. things are going a little hard in your practice. You don't really know how you're going to get by, let alone thrive. What are some things that you teach dentists to do to help them with stress, to manage stress, to
Yeah.
eliminate it, to live a more enjoyable, happier life?
Yeah. Oh, there's so much to unpack here. I mean, this could be like a whole half day course. I think the biggest thing is I love to simplify things. I simplify systems, I simplify processes. And if you can really streamline things in your practice from, your huddles to your schedule to your staff, to your case conversations with patients, if you can boil it down to the basics, oftentimes the basics are much less stressful, much less complicated, and way more profitable. So I'm really big on trimming the fat of everything, of every process in the office, getting back to
Yep.
bare bones, simple dentistry, simple systems. And oftentimes that really cuts overhead. So I'm known for being very efficient, very effective, and very productive and profitable because of that.
It's awesome. A lot of great information on your website. I want to encourage our audience to check it out, katieleedds.com. Check it out. Definitely some awesome materials on there. Couldn't stop looking at them myself. So I appreciate you putting
Okay.
that out there. And I appreciate you coming on and sharing today, Katie. Thank you so much.
Yeah. Thanks for having me.